So I'm Michael Amini. I'm a shoulder and elbow surgeon at the Core Institute, and we're really excited because we're starting to use a new device called the InSpace. It's a spacer or a balloon that we can use to treat patients with massive rotator cuff tears. The InSpace device is inserted arthroscopically, meaning we do it with a camera through a handful of small incisions. It doesn't require a big open approach. What we do is we insert the balloon, the spacer is rolled up into a little inserter. We put that into the shoulder. We fill that up with saline, which is sterile water. But what that balloon is doing is filling the space for the absent rotator cuff. What the rotator cuff does at the end of the day is it keeps the head centered into the right spot of the shoulder so that all of the existing other muscles that are intact can fire appropriately, pull the shoulder in the right direction, but the head's got to be in the right spot to do it. When we push the head back down, it provides the pain relief. It lets the other muscles work properly. It's relatively simple in a really elegant way because our other treatments have been to do really complicated surgeries with tendon transfers where we take a tendon from another part of your shoulder and reroute it, or we use cadaver tissue to sew it into the existing tissue, or we do shoulder replacement. So they're much more involved surgeries for us, much more involved recoveries for the patient. And despite being new to the US and despite being brand new, and we're doing our first one in Arizona right now, the beauty of this is we've got a heavy experience out of Europe. Data supports that it works really well. It works as well or better than some of our existing treatments. It gives people pain relief much faster. It's a much less invasive surgery. So that's one of the great advantages, aside from filling in a need that we have in the treatment of my shoulder patients. The other advantage is it's just an easier recovery for those patients. They're feeling better within a matter of a month or two. They're out of their sling at 2 weeks instead of 2 or 3 months. We're getting them back to function sooner, returning to hobbies, golf, regaining their quality of life at a much faster rate than we could do with our existing treatments. At the end of the day, all of those treatments are still necessary for me to treat everybody that walks in with the massive rotator cuff tear. So this doesn't replace those things, but it helps me fill in the gaps for the people that didn't really fit well into one of the existing treatments.